Dear friends, my name is Dr. Igor Atabekov and I'm clinical oncologist practicing since 2010. Today I'd like to talk to you about arterial hypertension. What is blood pressure? How is it controlled by our body? What drugs are available for treatment of this condition? How do they work? Main side effects and contraindications. I hope you can get some interesting and important information for you if you are suffering from the high blood pressure. And I will make the playlist of all these videos. The link you can see below under this video, and we start. Okay, first of all, arterial hypertension or high blood pressure is the condition when the blood pressure is permanently high. You need to check it many times. And if it's high for many times, then maybe you have this condition. Should you do anything with blood pressure? So what? You have a high blood pressure, you're feeling okay, maybe you don't need to do anything. But the problem is high blood pressure may cause some organ damage. First of all, we see the brain, we see eyes, heart, kidneys, blood vessels, and it's a risk factor for coronary artery disease, meaning that the heart will get less blood and less oxygen, and finally it can lead to pain and stroke. And also it can cause other complications connected to blood vessel damage. For example, peripheral arteries damage in the legs, problems with blood vessels in the eyes causing blindness, and damage to kidneys causing kidney failure. So it's quite serious. And that means you need to do something with that. First of all, I would advise you to have a diary where you will write down all your blood pressure measurements and times. So when you go to the doctor, you will show him the diary and he will assess what is your blood pressure measurements and when your blood pressure is highest, so he can choose the best regimen of medications for you. In most cases, their reason for blood pressure increase is not known, but there is a theory that if there are some problems with blood vessels, maybe spasm or maybe atherosclerosis, then their organs, especially brain, won't get enough blood and will be always deficient in oxygen and supplies, nutrient supplies, and it will try to tell the heart and blood vessels, so increase blood pressure please, so I will get more blood coming, and that may be the cause of blood pressure in many people. Sometimes there may be other causes, especially hormonal problems or kidney problems, but in most cases we don't really know the real cause of high blood pressure. You should always remember, if your blood pressure is not very high and if it's you just been diagnosed with arterial hypertension, first of all, you need to start from a lifestyle modification, meaning you need to lose your weight, you need to do more exercises regularly, you need to eat more healthy diet, and if it's not enough, then you need to add some medications. And let's talk about the mechanisms, how blood pressure is controlled by our body. First of all, let's start from the brain. We have a special vasomotor center of neural system that will regulate the tone of blood vessels and of heart. Our heart is the main pump that will pump the blood, and the more strength of the heart compression, the higher blood pressure will be. Also, the pulse rate, the rate of the heart contractions will increase blood pressure. The next, blood vessels are the tubes where the blood is circulating. The smaller the diameter of these tubes, the higher the blood pressure will be. And also how much liquid is circulating in these tubes. And this is mostly controlled by kidneys. The more volume of the blood, the more blood pressure will be. So we have a neural center in our brain that will regulate blood pressure. This is the part of autonomic neural system. Autonomic means we can't affect it, we can't regulate it. For example, it controls pulse rate. You can't control your pulse rate, or the heart contraction, or how much you sweat, or the diameter of your pupils, or how your guts are working. This all is controlled by autonomic neural system. There is a syndrome called white gown syndrome, when your blood pressure is normal, but when you see the doctor, your pulse increases, your blood pressure increases. That means you're nervous and this center is activated, and the tone of autonomic neural system will be more. And it will affect heart rate, heart strength of contraction, and the diameter of blood vessels. Here there are some medications that can control this mechanism, but I'm not talking about them in these video lectures because they are not most often prescribed. The next one is heart. The medications that work on heart are beta blockers. They will directly affect heart by decreasing the strength of heart contractions, by decreasing the heart rate. And these are medications that are ended with LOL. If you're taking some medication with a brand name, it may be not ending with LOL. That's why please look the drug instructions, see the active substance there, and if it finishes with LOL, then it means this is the beta blocker drug. The other group is calcium channel blockers, verapamil, diltiazem. These will work on heart too. Again, check instruction. If this is the case, then it's your drug. Why I'm saying that? Because I will make a playlist. The next short videos will be about the groups of drugs separately. So you can just go to the drug group which you are taking and see the important information that may be very valuable for you. Next organ is adrenal glands. This is very important and central organ of hormonal production that may cause the increase in blood vessel tone, that may cause increase in pulse rate, they will cause the kidneys to retain more water, for example. And these are main groups of drugs that are working on adrenal glands. ACE inhibitors, everything that is that finishes with pril, captopril, enalapril, lisinopril, lamopril, etc. Then angiotensin receptor inhibitors, all sartans, that finishes with sartan. They are very similar to ACE inhibitors, but they don't have some of side effects of ACE inhibitors. And one more is kidneys. Kidneys are very important because they will retain the water and increase blood pressure and salts, and also they will produce renin, that is a very important hormone that will finally increase the tone of blood vessels. That's why this is one of the organs which we can affect with our medications to decrease blood pressure. And these are, of course, diuretics that will cause kidneys to lose salt and water. These are beta blockers also, LOL. These are renin inhibitors, ACE inhibitors, again, angiotensin receptor blockers. And the last one is vascular tone, the last component of blood pressure control that we can affect. And these are ACE inhibitors, angiotensin receptor blockers, diuretics also, and calcium channel blockers and alpha-1 blockers. How do we choose their drug appropriate for individual patients? For example, alpha blockers, doxazosine. This drug will decrease the vascular tone, but it also decreases the tone of sphincters. For example, if the old man, has problems with prostate, he can't urinate normally, and he has high blood pressure, maybe this drug will be very good for him. Why? Because it will decrease blood pressure, and also it will decrease the tone of his sphincter, and he will urinate more easily. And all the drugs we used, all the substances, they never work on one single point in our body. They all work in many points. That's why we get lots of effect of every medication and lots of different side effects, adverse reactions. That's why we need to check what else does the patient have, and we need to choose maybe some of side effects may be used in these patients as beneficial thing. For example, if the patient has ischemic heart disease, if the patient has heart failure, diabetes, infarction, if the patient has very high cholesterol, we can use some drugs over the others. Dear friends, hope it was interesting for you, and I'm waiting you in the next videos about the separate groups of drugs. What are their good sides, what are the bad sides, what to expect, and if these drugs are good for you. And if you are taking any of these drugs, again, please look at their drug information and go to their appropriate video. And I wish you strong health. Good luck. Bye bye.